Millions of Americans across the country are preparing to bring their summers to an end this holiday weekend with travel and celebrations. However, health officials are issuing warnings over the implications this could have in the ongoing battle against COVID-19. Following previous holiday weekends like Memorial Day and the 4th of July, there were surges in newly confirmed cases across the U.S. Earlier, the Institute for Health Metrics and Evaluation released its newest coronavirus projections for the United States, given the current response to the pandemic. The IHME projects that given current interventions put in place across the country, the death toll will surpass 410,000 by January. In addition, if the government chooses to take a herd immunity approach by eliminating all restrictions, the IHME predicts the death toll could surpass 620,000 in the same amount of time. So far, we have seen more than 6.1 million cases of COVID-19 confirmed in the U.S., resulting in more than 186,000 deaths. Dr. Teresa Murray Amato joins me now. She is chair of emergency medicine at Long Island Jewish Forest Hills Medical Center in Queens, New York. Welcome, Dr. Amato. Thank you so much for being with us. These numbers in this model are just astonishing. The prediction of almost 3,000 deaths a day in December is the equivalent to the number of lives lost on 9/11 each day. So how can we keep the death toll to a minimum heading into the new year and ensure that these projections don't become a reality?
Well, thank you so much for having me. And I agree, these numbers are really almost unbelievable. What we do know that works, social distancing, wearing a mask if you can't social distance, doing hand hygiene as much as possible. These things we know will help stop spread the disease, that stop spreading COVID. So we still encourage people. We want people to go outside, be healthy, interact with each other, but to do so safely. Again, keeping the 6 feet distance as much as possible, wearing your mask if you can't social distance, and washing your hands as much as possible.
And you believe that applies everywhere, right? That people in areas where there currently are low rates of COVID-19 should not fall into a false sense of security?
That's a great question. I mean, this is a new virus. We don't know when it's going to maybe perhaps resurge. We're hoping it won't. But we do have some indications that it might. And so all these things we put in place during the height of the pandemic here in New York and in Queens especially, it really did what we call crush the curve. So I would say for people this is a marathon, not a sprint. We have to still be vigilant and be careful. The last thing we want to see are numbers like we saw, over this past summer and in the spring. So again, encouraging all the things we put in place several months ago as precautions.
So what advice also would you particularly give people heading into Labor Day weekend?
So again, we know that, being social and being together is important for mental health. So we do want people to try to get together if they can safely. So again, maybe avoiding those large crowds, try to keep the group that you're with to a smaller number. Again, outdoors we know is safer than being indoors. And if you can distance, 6 feet, we know that this virus is most likely droplet and airborne. And so 6 feet distance really helps stop spread that transmission. So try to stay apart if you can, outdoors also if possible.
And Dr. Amato, as we mentioned, the IMAG is projecting that the death toll will surpass 410,000 by January following the current interventions that are in place. In other words, if people continue to follow the guidelines that are now established. However, we know that several states, including New York, New Jersey, and California, are slowly repealing restrictions to allow additional mobility throughout their states. What impact is that expected to have on the projected death toll?
So again, this is a new virus, and so a lot of these models are based on a lot of assumptions that we're not quite sure yet where it's going to play out. However, we do know here in New York, the schools are going to be opening again soon. And so we're going to keep a really close eye on all these numbers. We get a daily report out from our local Department of Health looking for increase in viral-like illnesses higher than would be expected at this time of year. As soon as we would see an uptick, we would immediately go right into reporting that and start to think about whether we're having a resurgence. The other concern we have is we are going into what we normally have as a flu season. So we're not quite sure what the impact is going to be on that with a possible COVID resurgence. So we're being very vigilant looking at these numbers every day. We know we can't get it down to zero, but we want to get the transmission down to as close to zero as we possibly can to try to see if we can, drive those numbers down and not have so many deaths.
And doctor, since the peak of the pandemic in July, we have seen the number of confirmed new cases decline to an estimated 45,000 cases per day. Subsequently, testing and mask usage has declined across the country as well. What role do you believe a lack of testing has on these numbers? And are you expecting, as you just said, going into flu season to see another surge of new cases?
So so in New York, I can speak of New York pretty well. So in New York, we did increase the number of tests we were doing, and what we did see as we were increasing the testing, we were seeing at that time lower and lower positive cases. So we were seeing a very nice trend, which helped us to understand how we could open up. That being said, I think that it is hard to stay compliant with things like wearing masks and hand washing and distancing. And I do see the fatigue setting in. And those of us in healthcare, it does give us some angst because we know when we start relaxing those things that there's a possibility that this is going to come back and get to the numbers it was previously. But I keep telling people, again, it's the marathon, not a sprint. We've got to, try to keep up with the recommendations for the distancing and the mask wearing if you really want to keep this down.
Are you expecting, though, it to get difficult once flu season hits? What are you hearing about the flu this year?
So one of the thoughts is an unintended consequence of mask wearing is a possibility that we might have less flu than we normally do because, people maybe decrease the transmission just by wearing the mask for trying to decrease COVID. We really don't know yet what we're going to see. We have been having our resurgent meetings here at Northwell. We've been doing our flu meetings again. They started about a month ago. So we are being very vigilant looking at these numbers and really being very mindful for any beginning of an uptick so that we might be able to, start doing some more interventions sooner. But again, it's really unpredictable. It's a novel virus, so we don't quite know yet what it's going to do.
Exactly. All right. Well, Dr. Teresa Murray Amato, thank you so much for joining us.
Thank you for having me.